I am super excited to welcome you on behalf of the MSU Center for Interdisciplinarity to our 2020 Transdisciplinary Graduate Fellows Symposium. I'm Stephanie Vasco. I'm the Managing Director here at MSU C4I. So I'd like to start with a little bit of a presentation about C4I and about the program. And then I'm going to hand it off to the MSU C4I Director, Dr. Michael O'Rourke, to tell you some more about the program as well. So welcome. I've introduced myself. Michael, would you like to introduce yourself?
Hi, everybody. I'm Michael O'Rourke. I'm the director of the MSU Center for Interdisciplinarity, also a faculty member in the philosophy department, and along with Stephanie, one of the faculty leads for the TGFP.
So here's how we'll break down today's schedule. From 10 to 10:15, there'll be a bit of an introduction to Michael and I. It probably won't take us the whole 15 minutes. Our first talk this morning will be from Andre Bateman, Emily Greason, and Kathleen Lowenstein. And it will be on examining a community-engaged research approach to colorectal cancer screening and awareness. And then we'll do a Q&A as part of that. For Q&As today, please direct your questions to the chat, and then I will go ahead and moderate the questions from there. We'll switch over to our second team at 11 o'clock, and that will be Brianna Coleman, Taylor Mills, and Jessica Stokes, and they'll be talking to you about just stories, storytelling to center social justice through the arts and transdisciplinary research. We'll spend some time doing Q&A with that team as well. And then we'll do a final Q&A. You can ask questions for both teams. You can ask questions for Michael and I about the program and about C4I. We'll do a little wrap up, and then it'll be noon and time for lunch for everyone, hopefully. So the mission of the Center for Interdisciplinarity is to strengthen and nurture interdisciplinary research involving the arts and humanities at MSU, as well as locally, nationally, and internationally. We conduct research on interdisciplinary process, and we support interdisciplinary process as well. If we think about really the goals of C4I, it's that we enhance grants, lead research, and empower graduate students, all while working to build community for interdisciplinary scholars at MSU and beyond. This fall, as many of you know, COVID-19 has drastically impacted the way that we all do work and the way that we teach as well. We will still be running many of the signature C4I events that some of you are used to, some of you might be new participants too. We welcome everyone, so community members as well. We will be running the University Interdisciplinary Colloquium that will go entirely virtual. It starts on 9/18. It'll be at noon, and there'll be some Zoom links for that. So please check our Facebook page and our newsletter. If you haven't signed up, drop me an email for that, and I'm happy to respond. We'll be running our interdisciplinary write-ins as well. We're going to continue those. Those will be virtual as well, so keep an eye out in the newsletter and Facebook for those. And we're also looking to run a series of webinars and virtual events. So if you're interested in presenting a webinar, partnering with C4I, thinking about the ways that you can enhance your own interdisciplinary research, please do reach out and contact us. We are very willing to do collaborations across the board. So please drop me an email. So when I talked about the central tenets of C4I, about empowering graduate students. And so one of our objectives in being an organization involves graduate students explicitly. Graduate students at MSU are involved in the conduct and support of interdisciplinary research, right? This is a thing that many of us as graduate students, if we were graduate students, have participated in. And it's something that we are really interested in fostering at C4I because we're interested in the careers of scholars at all stages. We're committed to supporting graduate students who are thinking about participating in interdisciplinary research, want to try out interdisciplinary research, would like to try out community participatory interdisciplinary research. And so I'm going to turn it over to Michael right now so that he can introduce the TGFP program.
Thank you, Stephanie. in the spirit of supporting graduate students in pursuing interdisciplinary research, the center, when we launched in 2017, began exploring options for creating opportunity for graduate students on campus. And we found that while there were structured programs that enabled graduate students to enhance their capacity to conduct this type of research, there really weren't that many programs that were team-based, that focused on providing graduate students with experience and training in research collaboration. And there weren't that many that were explicitly transdisciplinary in the sense of involving community partners as research partners. And so we designed the Transdisciplinary Graduate Fellows Program with those two things in mind. So the TGFP, as we call it, is team-based, interdisciplinary research opportunity for graduate students. In particular, we build teams of 3 graduate students. Each team has people from different disciplines. Those teams work collaboratively with community partners, and they receive mentorship from the center in the conduct of integrative research. We've been really fortunate to have 2 fantastic partners for the first 2 years of the TGFP. The first is the Mid-Michigan Health System. And this year, we had the pleasure of working with the Mid-Michigan Health group in Gratiot, and Arturas Klugas, who's a program director of the Family Medicine Residency Program there, and Matthew Stack, who is a faculty member in the Family Medicine Residency Program. Matthew was especially involved in in the work of the Mid-Michigan Health TGFP team. I believe he's on the webinar, so he probably did the heaviest lifting on the community partner side. And then we've also stayed connected with Jeff Medden, who's the regional director of the Mid-Michigan Physicians Group. The second partner is the Arts Council of Greater Lansing. And Megan Martin, executive director of the Arts Council, has been a really great partner for both of the incarnations of our program. The goals and objectives that we've set for the TGFP pertain to kind of all of the players. So there are goals and objectives for the fellows. In particular, what we're hoping the fellows achieve by virtue of participating in the TGFP would be focused training in collaborative transdisciplinary research, mentorship related to academic and non-academic careers, experience assisting a community partner in responding to a complex real-world problem, and CVable deliverables to be determined by the partner and the team. So we provide fellows with an early short course opportunity to get used to this kind of research, and then support them in working with their community partners. The partner is kind of aims to achieve basically experience in developing a collaborative research initiative in where they're involved in all parts of the process. By participating in this, they contribute to the educational mission of Michigan State. They receive focused collaborative attention from a really smart group of graduate students to a problem that they bring to us. So it's a problem that they believe really requires attention, and then a final product from the collaboration. And the center, we've had the opportunity to develop what we think is a successful transdisciplinary training curriculum for graduate students that establishes relationships between graduate students and community partners, and through those relationships strengthens community and university relationships and enhances the visibility of the humanities. Quickly, the architecture of the program, for those of you who may not have, perhaps didn't join us last year for the symposium, we start with the short course, which is an intensive 3-day experience that focuses on training in collaborative transdisciplinary research, where the fellows are introduced to the partners. They also visit the sites, so they travel on the 4th day to, in this case, Gratiot County and then into Lansing. Then there's work in the spring semester that involves check-ins with the center and regular team meetings, and research questions are formed, initial research is conducted. IRB in both cases this year was a big part of the spring semester. Summer semester is when rubber hits the road, really. The regular team meetings that involve partner representatives, check-ins with us as needed, and the research really gets rolling in the summer. And then the last bit, late July, early August, involves finalizing deliverables. And today, the big finish. Our fellows teams were, again, associated with each partner. I probably should let Stephanie introduce this team since she is faculty lead for them, but maybe in the interest of time, I'll just go ahead and do this. The Arts Council of Greater Lansing team involved participation from Brianna Coleman, who's a PhD student in the College of Education, Taylor Mills, a PhD student in the Department of Philosophy and also a JD student in the Michigan State College of Law, and Jessica Stokes, who is a PhD student in the Department of English. The Mid-Michigan Health team involved contributions from Andre Bateman, who is in the Department of Kinesiology, is a PhD student, Emily Greason, a PhD candidate in the Department of Microbiology and Molecular Genetics. She's also in IQ, and Kathleen Lowenstein, who's a PhD student in philosophy. All right, thank you. And Stephanie, I think I'll go ahead and turn it back over to you.
So I'd like to invite our first team to go ahead and start their presentation.
Okay, I'll be sharing the screen, so I'll get that ready. Okay, so I'm Emily Greason, and I'll start us off today. All three of the fellows will be presenting, and we do have a couple slides from our community partners that we'll note in the presentation. And if you have questions that you'd like for our community partner or for us, we can address our questions either way, just to keep that in mind. Okay, today we'll be talking about reflecting on a transdisciplinary, community-engaged approach, specifically to colorectal cancer screening barriers in rural mid-Michigan. Just a brief overview, we'll be talking about an introduction, and then we'll go into project development, and then we'll talk about some concluding thoughts, some reflections and takeaways, and then we'll move into the Q&A portion. So I'll be going over the introduction today. First, just because there's a lot of moving players in the team, we'd like to take the time to go through the description. I'm not going to talk too much about C4I because Michael and Stephanie have already done a really good job of introducing that. So again, Michigan State University has a Center for Interdisciplinarity, or C4I. Again, Dr. O'Rourke is the director, and Dr. Vasco is the managing director. Dr. O'Rourke is the faculty lead for our team. And we are part of the Transdisciplinary Graduate Fellows Program. And when I say we, I mean the academic team. So again, currently enrolled PhD students involves Kathleen, Andre, and I. I'm a microbiologist in training. Andre focuses in kinesiology, and Kathleen is doing philosophy. Moving on to our community partners, we have a clinical team. And so they're Michigan State University residency program, but they're in the Mid-Michigan Health Consortium. And specifically, it's the Gratiot Family Medicine Residency up in Alma, Michigan. So we have two medical residents, a second-year medical resident, Dr. Rodriguez, and a third-year medical resident, Dr. Lyons. I believe Dr. Lyons is here with us today. And then we have also, as Michael had pointed out earlier, our resident program research coordinator, Dr. Stack. And so he has helped us push this project along and get some of the attention at the Mid-Michigan Health Family Practice. Okay, moving forward, we wanted to talk a little bit about team dynamics at the beginning. So in our transdisciplinary approach, a lot of the roles that we have in the team develop pretty quickly, just out of necessity, we think, although we did not deliberately assign roles to each member. So some of these roles included administrative tasks like meeting scheduling, note taking. Some were more managerial and coordination of activities, so timely communication, meeting of deadlines. Um, and then some fell into research tasks, so literature reviews or survey development. And we found that ownership of these roles allowed for effective functioning. But we think it's important to note that the roles are and have been dynamic, and helping us with that good self-awareness and emotional intelligence may have facilitated these good team dynamics when we look back. Not only were we reflective in the beginning, but we set ourselves up for success. And a lot of this was C4I with that short course at the beginning. So we did things like explicitly talk about a communication plan with our community partner and within our MSU team. So this included how to identify a breakdown in communication or how to move forward from miscommunication, because miscommunication is going to occur in a situation like this. Open dialogue at our initial meeting, I think, helped a lot. We took more time to do introductions and backgrounds in depth. And I think this helped us create a shared vision. So why are we all doing this project, and what are we looking for through working together? We've ended the short course with a tour of the Mid-Michigan Health, I'll be referring to it moving forward as MMH facility. Again, we drove up to Alma and we walked through the hospital and the family medicine practice. And this also involved a face-to-face meeting with the entire MMH team and staff. So more of the players at the hospital, not the community partners that we just work with in our meetings. And so I think this was really helpful, again, in getting a shared vision, especially at our community partners location. We also explicitly developed a collaboration plan with our community partners. So again, we're taking a transdisciplinary approach because of the complexity of the problem. It exists in a real life setting, and so it's going to involve both academic and community stakeholders. And so we developed this collaboration plan with the team right at the beginning in that short course time. And some of the things that we want to highlight that the collaboration plan included, again, we talked about communication and coordination. So technological readiness. So at MSU, we have access to a lot of different softwares and sites, etc. But our community partner didn't necessarily have access to those. So we need to make sure we were using things that they were familiar with and had access to. We talked about leadership, management, and administration, who in our team would be best suited to fit different roles. Conflict prevention and management was important. We talked about what trainings we might need. So in our C4I short course, we learned a lot, but also what guest speakers could we bring in to help round out our skill set. And then also we just talked about budget and resource allocation, so we were all on the same page up front. For our interdisciplinary collaboration, MSU's Transdisciplinary Resident Graduate Fellows, we met with the 2 resident physicians from MSU in their family medicine residency program. We went to Alma, like I said, and initially, and then after that, we met with the 2 residents and Dr. Stack, their mentor, twice a month, at least, if not more at certain points. And this team effort evolve beginning with review of literature into planning interventions, implementing interventions, developing a survey to address barriers to screening, deciding methods of delivery for the survey, and analysis of those surveys now. And so the plan moving forward as a clinic is to use the information obtained through analysis of these surveys to improve colorectal cancer screening rates. I should have said at the beginning, this slide is from the resident's perspective. So this is just an overview of what we did and what we're doing right now and how the clinic will be moving forward with the information and deliverables we've provided. One of the important things was clarifying expectations. So we found it important to clarify goals and expectations. For the MMH team, this meant the goals included increasing colorectal cancer screening more broadly. And they also had a goal of creating publication level research projects. In relation to academic literature, when we were looking from an MSU standpoint, we saw that there was relatively little research on colorectal cancer screening within rural populations. And we saw a possible role of the electronic medical records or the EMR system. There's relatively little published about this also. So we were looking at that when we were starting to think about our project. So colorectal cancer, or CRC, is the third leading cause of cancer death in the United States, and that's from the American Cancer Society. Rural residents may be more at risk than their urban counterparts since they've been found to be less likely to be screened for colorectal cancer. So that's kind of the framework, the background we were working in from our literature review. With that, I'll pass it over to Andre Bateman to talk a little bit more about our research project specifically.
Okay, thank you, Emily. So as we can see here, this is where we started understanding that colorectal cancer screening is a problem. And the research, some early research done by Mid-Michigan Health in 2018 suggests that the electronic medical records indicated that the CRC screening rate was below regional and national benchmarks, which of course is a problem. And these low rates of screening, of course, will increase the chances of CRC going undetected in the population, which is served by the hospital. And in a systematic review, Wang et al. In 2019 found out that low CRC screening rates may be as a result of patient barriers to screening. So we directed our efforts to looking mostly at patient barriers to screening. So in this review, the most frequently reported patient barriers in specific to rural populations were: one, the perception of high screening cost and lack of insurance coverage, so financial barrier. Secondly, there was more of an emotional barrier related to embarrassment or discomfort in undergoing treatment or screening. Third was more related to a lack of knowledge or perceived need for CRC screening. And finally, a lack of physician recommendation. So these were the key frequently reported barriers in this review. So because of that, our project would be significant because it will allow us to identify barriers to patient screening in this rural population from both a patient and provider perspective. And based on those results, we would be able to uncover targets for designing evidence-based interventions to increase screening in the population served by this hospital. And this would be both from patient and provider perspectives. So now I'll go into project development. So we started with a general research question to guide our research efforts. And the question was, what are the barriers to CRC screening from patient, provider, and system perspectives? So based on our review of the literature, and in particular that systematic review I referred to earlier, we hypothesized that the patient barriers would fall into the following categories: socioeconomic, so this would include the financial aspects as mentioned earlier; negative thoughts and feelings, so this would capture the emotional barriers; lack of knowledge, and lack of physician recommendation, sorry. And we further hypothesized that the patients who perceived more barriers would be less likely to engage in screening, and also that patients with lower self-efficacy associated with screening would be less likely to engage in CRC screening. So based on some previous work on colorectal cancer screening at MMH, in a study entitled The Effects of Incorporating Family Medicine Residents into a Rural Health Clinic on Colorectal Cancer Screening Rates, the results indicated that there was a decrease in rates over the period. However, it was suggested that the change in EMR in 2017 may be biasing the results. As a result of this problem, a literature review was conducted and to determine evidence-based interventions that could possibly be incorporated to help increase the rates. Additionally, based on Cervical Cancer Awareness Month, they implemented interventions, and the MMH team made notes of the structural barriers and their success. And they also completed trainings in the EMR to navigate the CRC screenings. So our general project goals were therefore to develop a publication quality study based on the barriers, to ultimately increase the CRC screening rates and ensure that there would be an emphasis on clinical interventions to increase these rates. Of course, COVID-19 has affected the world, and it did not spare our efforts to do this research. And as a result, there were some changes that we had to make as a result to be flexible in the face of COVID-19. So of course, the feasibility and effectiveness of data collection became unsure initially because of restrictions and possible burdens on the local healthcare system. And as a result, there were less opportunities for us to do in-person processes. Because of COVID-19, outpatient procedures weren't able to be scheduled, and there had to be a switch to the multi-target DNA stool test, which could be mailed, for example, the Cologuard, as a primary screening mechanism. And of course, we weren't able to travel to the clinic from MSU, so that opportunity was also lost. And the awareness of this dynamic environment because of COVID-19 forced us to be constantly thinking of other adaptations while conducting this project. So one of the major aspects of our research project was to develop a survey instrument to capture the barriers to colorectal cancer screening. So this survey was developed primarily based on the review of the literature as done by Wang et al. As presented earlier. And we also integrated items from previous surveys. The survey focused on integrating aspects of the health belief model. So this was a theoretical psychosocial model that drove the survey development. So we focus on the risks, benefits, barriers, and knowledge to colorectal cancer screening. And we also integrated self-efficacy theory, which refers to personal capability beliefs about overcoming barriers to CRC screening. And then once the survey was designed and developed, we attempted to collect data. And of course, because of the limitations due to COVID-19, we were unable to do in-person survey data collection. And as a result, the surveys were distributed via Qualtrics through the MMH portal, and we also did mailed surveys. Our target for the survey was to reach a sample of 300 people from the population. We are currently in the process of this data collection, and now we have approximately 140 responses. So we have approximately reached halfway to our target, which is good considering the circumstances. Interestingly though, the mailed responses had a higher return rate than the Qualtrics surveys, and we found that interesting, and it probably speaks to the characteristics of the population to be more responsive to mailed surveys than electronic surveys. And we recently just sent out a second round of surveys. So our intention, once data collection has ended, is that we would conduct data analysis using SPSS. So we would do initial descriptive statistics, such as determining the percentage of on-screen respondents in our sample. And then we would progress to inferential statistics, such as determining correlations between colorectal cancer screening and perceived barriers, and ultimately to see how these variables would or affect actual screening rates. And now I'll hand over to Kathleen.
I'm going to talk about this portion. Close.
Emily, sorry.
Okay, so this is, we have a couple more slides from our community partner, but in the interest of time, I'll be reading them. So this one is from the residents, and this talks about the interventions that were done at the family medicine clinic in Alma, Michigan. So some of the interventions were implemented. They were all to improve rates of colorectal cancer screening. So first, they reviewed with the providers how to track patient panels and set goals with incentives for each provider to address those on their panels that were due. And so as a follow-up from that, providers called patients with options of screenings. We talked about earlier, the options of screenings were a little more varied at the beginning, but they moved to the multi-target DNA stool test during COVID. They also ran a campaign in office for the need of screenings. So they had things like the poop emoji stickers seen in the upper right here. They had scripted information regarding the need for CRC screenings. They had a leaderboard with individual screening rates, so you could see where you were among other medical providers in the practice. And there were options made for medical assistants or MAs to educate patients. And following up with that, they tracked each provider's numbers and gave them feedback on those numbers. If you were increasing, decreasing, staying the same, and what those numbers meant. Specific medical assistants were assigned to send out and follow up multi-target DNA stool tests like Cologuard. And again, that was a move during COVID. At each visit, the need for screenings was addressed by providers. So there was more of a push during appointments. And these interventions resulted in an improvement in screenings despite the pandemic. And this also decreased in-person appointments. And so the clinic, as are we, are pretty excited about that. And we'll talk a little bit more about where we're moving with this interventions portion in a bit. And then this is from Dr. Stack, the head of the residency research program. And so these are just some systems levels observations at 3 different levels. So in terms of IT, there is not intuitive access to different performance data for the medical providers. This is in the electronic medical record system. So it takes a little while to get into the system to see even your own rates. Additionally, the EMR metrics are not necessarily capturing the increase in rates. It's a little bit of a flawed calculation. At the clinical level, there are multiple and conflicting quality improvement priorities. So there are a lot of different metrics that they have to balance as medical providers. There was also a lack of recognition when troubleshooting for patient hurdles. And there was inadequate follow-up. So there wasn't closed loop communication. It wasn't always clear who personally was supposed to follow up if there were patient barriers or a lack of screening. At an interpersonal level, there were some turf issues and some providers were hesitant to do things deemed as clerical tasks. And additionally, some key implementers were not at the table. So if you have any questions on these last 2 slides, again, we can direct your questions to our community partners who are here with us today. Our current project status, just to update, we should be entering data into SPSS soon as we finish collecting the survey results. And then we'll follow up with the data analysis, as Andre mentioned previously. We'll be working on writing possibly 2 manuscripts. So our first one, the MSU team will be leading, and this will be our barriers project to colorectal cancer screening. So this is talking about at a patient and provider level, what are the barriers in rural mid-Michigan? Additionally, when I talked about the interventions that have been done at the clinic and how they improved screening rates during the COVID-19 pandemic, the Mid-Michigan Health team would like to focus on that for an additional manuscript. And while that will be led by Mid-Michigan Health, we're more than happy to help in any way we can with that manuscript. Additionally, if you're interested and want to hear more about our project, we'll be doing a poster presentation for Public Engagement with Science, or PEWS 2020. And that's going to be virtual. It's hosted by Michigan State. And that will be on September 11th from 10 to 12. With that, I will pass it over to Kathleen, and she's going to talk about this idea of having a project in dialogue.
Great, thank you, Emily. I'm going to be talking a little bit about the dialogical process of research design that we tried to highlight in this process, and then transitioning through to our conclusion and some of our general takeaways. So Emily, if you could advance the slide, that would be great. So one of the things that we tried to do from the very beginning of our project was focus on explicit dialogue about the research process and the project itself. And some of the things that we talked about at the very beginning were some of our key goals. And for the MMH team, that was identifying barriers at the clinical level, e.g. in terms of distribution of surveys and tests and practical impediments to both the research project and distribution of screening tests. And then for the MSU side, it was survey development to assess barriers to the screening and population. And on both teams, we focused on a facilitation approach to research design and interactions with one another, where we try to hold space for shared discussion of mutual goals. We work hard to clarify concepts when we're talking to one another, because one of the things that has been found both in work in biomedical ethics, which I specialize in, and in work in transdisciplinary team process overall, is that oftentimes across fields, people might be using a concept but have like a different meaning behind the concept. So we would try to clarify what we meant when talking about terms, and also working on keeping the space open in conversations with one another, both in terms of having an openness to different ways of interpretations, but also in a more literal interpretation of space in terms of thinking about the dynamics of the clinic and the dynamics at the end of the individuals at MSU, and how institutional dynamics might also impact research design and the ways in which the clinical interventions were staged, like Dr. Stack's slide was a good example of that, where he talked about some of the things that were impacting the survey in the clinic. And then another good example of that is when we were talking with the residents about survey development, and they noted that based on the population they're working with, that they thought we might have a higher response rate for the paper surveys, and they were very much true about that. And then another way that we worked to keep the space open was through frequent email check-ins and then Zoom meetings, and we had planned some additional meeting visits to the hospital, but as Andre noted, COVID-19 impacted our ability to do this. So what does it mean to conduct research and dialogue? Well, for us, this meant clarification of goals and definitions, as I mentioned on the previous slide. So what do those terms mean in process? And then a dialogical process of research design itself. So an openness and reflexivity, as I previously noted, in terms of both the design and definitions. And this has resulted in an explicit discussion of the interdisciplinary research process itself with the team. And we talked about articulating unarticulated values. And we had many conversations about how to acknowledge varying forms of expertise, which I think you also see sort of noted in Emily's this slide about different tracks for publication also, while still acknowledging shared expertise of all individuals in the room. For example, Andre has expertise in survey design, and the MMH team has expertise in terms of clinical practice, so it's important to place those in conversation with one another while respecting both forms of expertise and talking about how to both align those in working towards our mutual goals. And if you could advance the slide, Emily, that would be great. And so to continue on that track, we focused on ultimate openness and vulnerability in our conversations with each other and in discussions about the research and the research process itself. So being receptive and listening to different ways of being and noting. And this involves like a particular focus on vulnerability in dialogue, like a openness towards being empathetic towards another's position and the acknowledgement of experience and listening to believe. And as I previously noted, has focused explicitly on facilitation of our shared goals. So what is important in terms of goals for both MMH and the MSU side, and this conceptual and terminological coordination that I noted previously, which is crucial for any part of research. And one of the things that we did find as a key takeaway from the project overall was the need to be dialogical about the methods, the data, and also the team dynamics, which is key in our disciplinary work. And it's reflected, as I previously noted, in appreciation for the different kinds of ways of knowing and also the various ways in which we interact non-linguistically. I will note that this was easier to do prior to COVID because there's something about being in a room with someone and sharing space with them, but we made sure to have regular Zoom check-ins. And I think that was very helpful for us as a team because it enabled us to, literally sit down and share space and talk about the project and the goals overall. And I know that both the MSU and the MMH sides noted that that was helpful to have that space held for the project. So in general, takeaways in the research process itself was that thinking about the research as a dialogical process was helpful, particularly in centering our shared goals and understandings, explicitly working to reflect various forms of expertise in the research design and the process, and acknowledging different ways of knowing throughout the research process itself, which is something that continues as we work towards survey analysis and towards publication overall. So I'm going to start us off on some of our concluding thoughts, and then Emily and Andre are also going to weigh in. So one of the things that we noticed in the project overall that we wanted to highlight was that, and we were aware of this moving forward, but I think it was explicitly centered when we started thinking about dialogical research design, is that building a successful transdisciplinary team takes time. It's important to develop trust and to collaborate on developing a shared vision for the research process. And also to productively work through differences, that this can sometimes take effort and patience, and that there are different leadership styles in different disciplines and different ways of working through problems. Like medicine often prioritizes fast response, whereas the academy is sort of like known and criticized for having this more like detached thinking through of problems and sort of aligning those together in our research project overall. And then I think Emily is going to speak a little bit to our third point.
Yeah, so we just wanted to talk about balancing clinical and research goals and knowledge and how important that is. And so we did this a little bit at the beginning and then tried to keep doing it as we move forward, but acknowledging multiple forms of expertise. So when we got to survey design, Kathleen and I were more than happy to support Andre, who had done it before and was more familiar with the psychosocial model. And so we moved back into a more supporting role. And we've moved back and forth for that and for different tasks that we've done. And then it was important as our project was dynamic, especially with COVID. This was even more important, was managing goals and expectations. And I know we keep saying that, but it's because it was so important at the time and still is, just to make sure we're on the same page. Even with bi-weekly or weekly Zoom meetings, checking in with email in between. Sometimes we would realize that the community partner was thinking one thing and we were thinking another, and we were kind of veering away from each other. And so then we would check in and say, okay, what were you thinking when you had suggested, this? And they would say something and it made complete sense, and there was just a lack of communication. Or explicitly stating our goals and expectations, and then we were able to reconcile and move forward together from there.
Yeah, and just to
Yeah.
just to continue and caption everything, one of the things that we realized too is that working in a team is very dynamic, and roles change and situations come up, and it's very important being on that team to focus on the goals that were decided upon initially, and embrace changes as they occur, and recognize that changes are a part of the process, and flexibility in adapting to these changes will allow the team to still be successful in achieving the desired outcomes, even if these outcomes also change. So the process is dynamic from start to finish, and that's something that we had to be very aware of and respond positively to with flexibility.
Sorry, I was muted. Okay, with that, we have references, and if you have any more questions about the references, we'd be happy to send these out. And with that, we can take Q&A. I believe Stephanie is going to coordinate.
Yeah, so if you have any questions for this team, please do drop them in the chat, and then we will moderate them from there.
And again, we have our community partners with us, so if you have any questions that you wanted to direct that direction to, we can try to answer and have them answer too.
We could go ahead and invite, I think at this point, our community partners are not allowed to talk in the webinar, but I think we could enable that and then invite them to chat as well. And that's James, right?
I have them as guests talking permitted.
Yeah. So I believe that James, Matthew, and Michael, that you're positioned to talk now. If you want to follow up and emphasize anything or maybe expand on anything, you can do that now, I think.
Yeah, I'm available here for questions. Is there a lot of feedback there?
Yes.
Yeah, I'll just say that I think the team did a great job presenting this, and it's been very exciting and interesting for me to work with the team, and had a great experience so far, and I look forward to our continued work together. And I'm available for questions too.
I know I'm the faculty lead, but I'm going to ask a question anyway. Oh, maybe there's a question.
Yeah, I would actually ask Michael that we defer to Robin's question.
If there's a question, yeah, if Robin has a question, let's go with that one.
So Robin asked in the chat, thinking about what you learned from working on this team, which things do you think would be helpful in starting a new and different interdisciplinary collaboration?
Thank you, Robin. That is a good question. I would also be interested in hearing thoughts on this from the MMH end. I know that we had previously talked about this on the MSU side, but one of the things that I would say on our end is prioritizing prompt communication over like very thorough and very detailed communication, which I think I was gesturing at in my slide about academics. Like I think especially for the people trained in philosophy, like we have a tendency to want to give a very good response, and then sometimes Matt just wanted a response. And Matt, to his credit, is very good about very promptly replying to emails. So I think on our end, it would be making sure to communicate more rapidly with them in order to keep the chain of communication flowing, and maybe making a more explicit effort on our end to like keep that chain going from the very beginning.
I could also add to that, where if I were to start a new and different interdisciplinary collaboration, one of the things that I would ensure that happens is that, well, on the front end, to try to think about where differences between academic disciplines may occur, and also where differences between academic and the community organization may occur also, and to have this early discussions about those possible differences, but to also, and probably even more importantly, recognize when differences are affecting processes during the collaboration, and having discussions, open discussions about these differences once they come up during the collaboration. I think that's very, very important.
I think for me, and I completely agree with what Kathleen and Andre have said, but adding on to that, we figured this out later on, and this is such a boring detail, but you need to set up your next meeting before your first meeting ends. And what we realized is everyone is so busy that it just slips through the cracks, and all of a sudden it's next Thursday, and you're like, weren't we meeting today? And then you realize you never explicitly said anything or sent a Zoom link. So definitely, we figured it out eventually, but yeah, thinking about details like that, I think, are important from the very beginning.
I'm gonna chime in here as well. Oh, I know it's gonna echo. How's that? Is that loud? Still echoing? I'm sorry, you guys. They had it set up with a computer system here, so then I just unplugged everything, and it's just a laptop now, so it should work okay.
That's much better. Thank you.
Thanks. So I would say I'm James Lyons. I'm the third year resident on the team here. And something that we talked about awfully late, and it echoes what Emily was just saying, is that, maybe, a lesson that I've learned so many times is like defending your own time and making the time for things. I think as physicians, we oftentimes put patient care above all else, including, research in this case. But then this year, I took on a new role as chief in our residency, and then I'm kind of flooded with these meetings, and to every meeting thinks it's more important than other meetings. So oftentimes it would go over, and I'd be late to the meetings with the team, and then you're really not addressing everything in full detail like you would want to. So I would say just that fully protected time, and treating it as protected time, not just by name but by actual action, is something that going forward with our residency, not just for our research program, residents are required to participate in research. So I'm sure I'm not the only resident that faces that or have faced that. So luckily I'm in a position where I can advocate for that for the first and second years coming up and choosing their research projects. And I believe the first years right now are collaborating with their own MSU team in a different sense. So I think that's something I've learned is critical to making progress, because when we did spend the time, I felt like we did make a lot of progress, but then when I wouldn't be able to be there, or my counterpart Michael Rodriguez wasn't able to be there, and then Matt Stack, our leader, is also seeing patients, then and he's the only one that sees patients on that Thursday. Me and Michael are both chiefs this year and both pretty inundated with meetings and different responsibilities as far as that goes, or just managing our time, really.
Maybe time for.
Have any other questions from the audience?
Yeah.
And if not, Michael, I'll let you ask your question now.
Okay. Well, okay. So I really appreciate the attention to dialogue as a part of the as a way of thinking about the communication dynamic within the project. And I was kind of curious if maybe you could speak a little bit more directly to like kind of pragmatic recommendations that you might make if for someone who would like to have their their projects communication dynamic be more dialogical, right? Are there things that you learned in the process and of doing this and then reflecting on it that you might recommend as a way of retooling communication dynamic to make it more reciprocal and dialogical?
I can answer briefly, and then Kathleen can take over. I think, so the MSU side, we created agendas for most of our meetings with input from our community partner. So I think in our agendas, we found it was helpful, even if it wasn't necessarily explicitly stated in the agenda. For each point, we would check in with individual members. So we would say things like, James, what do you think about that? Or just direct it to the residents. What do you guys think about that? So asking a question instead of just saying, does anybody have thoughts on this? So by asking people directly, you would find that sometimes they did have thoughts, they just weren't speaking up. And I think that goes for the academic side as well. Kathleen, do you have more to add?
Yeah, thank you, Emily. I agree with that. I was going to say two things. One of them is building on yours, which is a really good point, is that at the very beginning, we wrote like more rigid agendas of like, oh, we're going to talk about this and this and this and this. And then we tried to make them explicitly more dialogical, because I think then we all just felt semi-tied to the agenda, which gets back to the point of holding space, which also gets to the point that James was making, that I think it's very important first to have just the space to sit down and interact with each other as a team, whether that be in person or virtually, because it felt like a lot of our most productive points or our tensions were worked through in those Zoom meetings, because there's just something different about seeing someone versus talking about things every email and all being together, even if it's a shared virtual space. So that point, and then going back to Emily's point, also it's being open and flexible, where we started trying to write slightly more flexible agendas so that we could check in with each member of the team. So it's more about just a meeting of like, well, what do you think we need to discuss in this meeting? Like, I think I've actually started that in the past couple of months when we had meetings. I'd be like, is there anything especially pressing before we move to the agenda items, right? Because sometimes there is something much more pressing, and then the agenda just doesn't matter as much, because maybe it's something that you can discuss in a month, or maybe that's an issue you're going to bracket for later, and this thing is something we need to talk about right now. Like, we had a meeting yesterday with the MMH, and James shared a very helpful item about the electronic medical record. That was very useful for us to know moving forward. And I think just like that openness and flexibility towards modifying goals and being open to your agenda was really helpful. And that seems like a minor point, but I think it's an important one, right? Because it like restructures how you're approaching your interactions with the other.
Thank you. That's very helpful.
If anybody would like to weigh in on the MMHN, or if Andre would like to add something about this, I would also be interested in hearing your thoughts.
I was actually thinking that right when Dr. Rourke had asked that, I wonder how this would have played out with in-person meetings. Because, here in the hospital, a lot of those meetings we have are in person. So it's much harder to, I guess, avoid or like put off an in-person meeting, or someone stopping you in the hallway saying, hey, Dr. Lyons, I wanted to talk to you about this or that. And then, I feel like I have to stop and talk to them, not say, you know what, I have a Zoom call that I really important, because I don't know what they're stopping me for. And oftentimes it's not something emergent or something that has to be dealt with right then and there. So yeah, I wonder if it was an in-person meeting and here at MSU, then I think that maybe that dialogue would have been better each week, and we would have been, coming to it a little more prepared, instead of the progress being made in the meeting and then outside of the meeting, just once a week. I think the changes could have been quicker. However, it's also easy to, in those meetings, say, okay, I'm going to work on that this week, and so the same problem may have continued.
Yeah, but I appreciate you bringing up that point, because when I previously worked in hospitals, we had monthly in-person team meetings. And I think that was really helpful, because like you're saying, it's harder to avoid an in-person meeting, and there might still be issues with follow-up, but there's just like a different dynamic when you're in person versus meeting virtually. And I think you're tracking something important there. And we had originally hoped to have like more in-person meetings with you guys, and then COVID happened. So I guess like in future, if that was a possibility, it would be, I agree with you, that would be very helpful.
All right, if you have questions for this team, as we think and move along, we'll have another Q&A session toward the very end of our symposium this morning. So keep them in your pocket, put them in the chat, and we can come back to them. I would like to invite our second team to start their presentation now.
All right, let me get this sharing situation going. My team members ready to go? I can't quite see everybody.
I'm ready.
Perfect. All right. So my name is Taylor Mills. We're going to give more helpful introductions of ourselves in just a minute. But I just wanted to first welcome everyone. Thank you for showing up on Zoom on a dreary day. We are excited to tell you more about the work that we've been doing for about 9 months. And we've titled this presentation very close to our whole project's title, which is Just Stories, Perspectives on Social Justice from Local Artists and Arts Organization Leaders or Curators. So before we get too much further into our presentation, though, we do want to acknowledge the lands on which we're presenting. So we're speaking from Michigan State University, which is in the kind of greater Lansing area, East Lansing area. And we want to collectively acknowledge that MSU occupies the ancestral, traditional, and contemporary lands of the Anishinaabe, Three Fires Confederacy of Ojibwe, Odawa, and Potawatomi peoples. In particular, the university resides on land ceded in the 1819 Treaty of Saginaw. And we recognize, support, and advocate for the sovereignty of Michigan's 12 federally recognized Indian nations, for historic Indigenous communities in Michigan, for Indigenous individuals and communities who live here now, and for those who were forcibly removed from their homelands. By offering this land acknowledgement, we affirm Indigenous sovereignty and will work to hold MSU more accountable to the needs of American Indian and Indigenous peoples. So like I said, my name is Taylor Mills, and I'm a dual degree student working on a PhD in philosophy, and also, as of this week, started a JD with MSU's College of Law. My areas of interest tend to be social justice oriented, so feminist philosophies of technology, Indigenous philosophies, Black feminist epistemology, Latina feminisms, and then immigration and Indigenous law.
So my name is Brianna Coleman. I am a PhD candidate in the Department of Educational Administration, and my work centers on urban education, race and education, community engaged scholarship, critical theories, and transformative epistemologies, and student voice.
My name is Jessica Stokes. My work is also steeped in social justice and environmental justice in particular. I am doing a research project based in the work of disabled poets in Pacific Ocean worlds who are rethinking how to respond to climate catastrophes. And I've turned my mic off, but I am also explaining this slide to you. So our project, as you can see, a lot of our work already overlapped with social justice. And so we have that just before stories. Just Stories was meant to document the experiences of artists and curators involved with the Arts Council of Greater Lansing, which we'll refer to as ACGL. This project focuses on the necessity and impact of a social justice framework in order to articulate how art is important in building community. So we interviewed a variety of artists and curators from across this community and then turned those into stories, some of which were written narratives and some of which were videos, one you'll see later on in this presentation. And then we also worked to design a sustainability tool for our partner that would make it so they could continue to collect these stories even after the end of this iteration of our partnership. And you'll hear just a little bit more about that now.
So I won't spend too much time on this because Michael did introduce kind of like the partner just a little bit in the beginning. But so our partner was the Arts Council of Greater Lansing, or ACGL, and they exist to support, strengthen, and promote the arts, culture, and creativity in the capital region. Their vision is to transform communities and lives through the power of creative expression. And then for the needs for that prompted this project was that their members had lacked the means for documenting and sharing about their recent performances, and didn't feel like they were able to like really communicate their stories to draw in like the audiences they expected. And then also ACGL had committed to an annual advocacy month, and they need materials that can support their advocacy efforts during that month, which is March. So we're hoping that these stories can also be used for that.
So what this process ended up looking like was coming from a truly transdisciplinary approach. We three from various departments and backgrounds came together to try to come up with a research question that would guide the work that we did and of course address the needs of our partner. And I would say that this might have been one of the longer, more challenging parts at the beginning of coming up with a way to frame what we were hoping to do and how we were going to address these needs. And so pre-COVID times involved multiple 3-hour coffee shop and whiteboard sessions, which we now look very fondly back on. And these were really great times. And we came together and came up with this research question of what can artists' stories told through a social justice lens tell us about the importance of art in building community. So moving from that, then we did right away identify some challenges. The first was identifying and defining the differences across our understandings and our partners' understandings of advocacy. So what does Advocacy Month mean to our partner? What does advocacy for us mean? And how are we going to clearly state that in our project going forward? And of course, as any community engaged research needs, there's this balancing act that you need to do between your research aims and your partner's needs. So we definitely navigated that and learned a lot from that process, as well as the challenge of just engaging with a diverse body of participants. When you're asking folks about social justice, that can be a very personal interaction, or it can be a very kind of abstract academic response. And so there's just a wide range of approaches to that particular topic that we definitely needed to navigate throughout this process. So as Brianna mentioned, our plan was to, or sorry, Jess mentioned, our plan was to curate some stories and call it a sort of advocacy storybook that would help the ACGL communicate to potential donors and politicians why art development, arts and culture are so important for the greater area of Lansing, as well as creating that sustainability guide. And so our methods were rather mixed. So mixed media data collection, interviews, narrative collection and curation, and then a whole lot of Zoom. So.
And that whole lot of Zoom came about because of the impact of COVID on our project. Something that we had imagined going into the project was we'd have multiple beautiful camera angles of the artists. We'd employ the resources of MSU to create these very dynamic shows. But for somebody who's been perhaps keeping up with late night or gotten used to the sort of lower quality of all of our TV right now, the materials that we ended up creating had to employ Zoom and their sort of back and forth. And you'll even see in the video I show later that I've edited a couple moments that I was realizing this morning where the screen shifts back to me, the interviewer, for just a second that I haven't yet edited out. So I'll be going back to try to do that. But there were just challenges in Zoom that we hadn't imagined. And that is interesting because my work as a disability studies scholar is one that has embraced critical disability methodologies. So I've often worked with partners who are at home in bed and are going to interact with me only through online media and in a very slow sort of format. And I've learned from the work of women of color scholars such as Gina B. Kim, who have constantly pushed back against the pace of academic spaces that demand more and more of people, even when they're going through moments like cancer. So Kim writes about Black feminist poet and thinker Audre Lorde, who in this moment of going through cancer is not given the time she needs to pause or to have space. And in my work, I've always tried to make space for that pause. But we as a team were in a moment where suddenly we needed this kind of critical disability methodology to be gentle towards all of us as COVID changed the kind of practice that we were going through. And we had to figure out, how do we communicate that with our partner? So we had to apply for IRB, and this process of getting our research approved as an ethical kind of research by a board here at MSU was much slower than it was meant to be. You heard earlier that Advocacy Month was March. Well, March was only a few months into our project, which started in January at the turn of the year. And we realized that next March was actually when we would be able to finish and create the sort of materials that we needed, or by this time, but with a sort of goal of being part of the Arts Council's Advocacy Month in the following year. And so there were moments at the beginning where we didn't quite communicate that slowdown in the way that we would like to, and we had to work through what it would look like to share this slow method with our partners and make space for people in our various paces in this pandemic. And so next we are going to see one of the stories that we were able to create. It's an interview with Ryan Holmes, who is an artist here in the Lansing community and who is also a teacher and somebody who's thinking about community and the arts all the time. And so I hope it gives you a little bit of a feel into the impact of social justice on arts and art storytelling.
Apologies, I just want to make sure that I get the audio correct. So I'm going to share computer sound so that the video comes up correctly. Okay, here we go.
I am a local artist and creative. I am also an art educator. I have been an artist since I was 5 years old. I started drawing around kindergarten, and I was basically outed by my kindergarten teacher as gifted. So at that point, I was put into summer programs, and every year I kind of grew in art. When I got to high school, I also started working with children and childcare, and there was kind of a pollination of a love between education and art for me. I opted to go back into the educational field, and I've worked with special needs students, emotionally impaired and physically impaired, from preschool to 8th grade. And in this last year, it's all kind of culminated for me is actually working as an art teacher and being a practicing freelance artist throughout the community and doing a lot of placemaking with art throughout the community. Traditionally, I was a pencil paper kid, and I got into art from sitting and drawing the cartoons and trying to emulate comic books I was looking at as a child. You know, I'm sitting drawing still lives. I'm doing pottery. I remember doing printmaking and foil rubbing, like just random stuff. And it's just like, now I appreciate it because what it did was it gave me a boldness where a lot of people cower when there's new elements added in art. I always watch kids who are great drawing. They love drawing, but then you're like, now put some color on it. And they're like, I'm going to screw it up. No, from a young age, I was kind of given all these things to manipulate and mess around with. And so in turn, I watercolor continuously. I do acrylics continuously just for fun. and I do graphic design. So I work on a computer a lot. I can do comic book illustration. I do logos. So I really do run the gamut. I've been, because of that talent and the community that I'm in, it's like, hey, can you paint our windows? I guess I'm learning how to paint windows. You know, it's just like people keep challenging me. The kids I work with, I'm drawing Spider-Ham. You worked with kindergartners for 17 years. You know, you have to draw every Power Ranger, every SpongeBob character. You're going to be challenged. I've been well noted for doing chalk art. So, and that kind of has spun off into an ability to work deeper into community with art. But it initially started in downtown Lansing at the Tin Can Bar. When they opened, they have an entire wall that's all chalkboard. I do a lot of the 3D art where you break the ground or you make optical illusions. So it's a couple years of just diving into perspective and cracks. I was like a year of me just looking at parking lot cracks like a crazy person. In college, wanting to do comic books and cartoons, you're always aware of your characters, but then in order to make them dynamic, you're creating environments. So you need to know perspective to create city blocks and buildings for superheroes to fly through and fight on. I have been gifted through the city and its ability to, as it defines as art culture, it's kind of given me a name. I kind of built an artistic culture up around my community. In my community, art is fully realized when dialogues begin about it. And that's why it's such a beautiful way to place make and create community and culture with it. And everything that we do is important. And just by the small things that we can do, by my broken computer screen, which I'm looking at right now, and a hand-me-down webcam, I've been able to. And not only is it me powering myself, learning, becoming better, but the kids I was able to reach out to, the families I was able to help, just understanding no matter what you have, you're able to use that and be relevant in your community. I had a billboard a year ago through the Arts Council, and that has also been something where a lot of people have gotten to know me more and follow me through. They have been extremely supportive. As far as, like I said, I was part of the Billboards in the Sky project, where they choose so many artists a year to have a billboard for 1 year. And that was super instrumental in getting my style out. They're phenomenal. I can't say enough about the idea of them wanting to work with me. I was unaware of how inclusive our art culture was. They were looking for the different people's voices to make up what is the council. And that they're just sitting there, man. They're sitting there ready to help you. They have so many resources. They'll help you write grants. They will help you find things in your area. When I opened up the Zoom meeting, above it was Don Gorman saying, here are some opportunities for you. And those things are there. And so to know it's empowering. So I'm just grateful to them that they empower me. But that's the agenda, kind of being like, it is for everybody. Poetry, music, film, all those different things can shine light on injustice and allow us empathy in order to see people's sides. And that's a lot of what causes injustice. We are built in other people's beliefs, or we have beliefs that are handed down to us. So it's really hard for us to see other people's points of views. Art is definitely a way for us to look through another lens and not feel necessarily as attacked to have to step outside of our bubbles and think of what somebody else might be going through, which can allow a safe place in order to have that experience or to heal from injustices, or to feel, heard or validated. So I think it can be very important.
All right, so I just want to make sure that the audio is right again before I jump back over. And I'll also mention that we were able to interview and create 11 of these stories which was, I think, right around the number that we were hoping for. And so that's really exciting for us. Okay.
Okay, so I think an interesting thing about this project is like when we were designing it, we sometimes got kind of lost in, okay, so we have the research question, but how do it necessarily fit with collecting stories? Or we're focused, like hyper focused on how we're going to collect these stories, but oh yeah, wait a minute, what's the research, right? So we, I think one takeaway was really understanding how you could do a community engaged project using like the skills and resources that we all have as a research team for an organization, but then also learning how to also build the protocols and things around like what we actually want to learn from the research at the same time. So we wanted to take this time to go back to our research question and just discuss some of our findings from it. And these are, I think, more so preliminary, but just things that we took away from our interviews with the artists. So our research question again was, what can artist stories told through a social justice lens tell us about the importance of of art and building community? So I'll start first with a couple of findings I pulled out. So this quote reads, just think of music, the impact music has on other people and how it makes people think and discover and maybe change their mind or look at something in a different way. Poetry can do the same thing. We've seen it in drama, so many different musicals and plays that address social issues. So this was from an artist who does photography in a Lansing area. And he really thought about art like sending messages or bringing awareness or expressing feelings regarding social justice issues and helping people to like embrace that in a different way and then like learn from it or use it to like change their minds or perceptions on things. The second quote, and it's just a sentence, and it says, the first thing that comes to mind is education. So this artist, she does more like videography work, and she really does work with like local people who are doing like advocacy efforts, as well as like people who are in politics or, advocating for some kind of cause. And for hers, she felt like it really, if we focused on art more so in schools, it could be a means to learn like history or learn different perspectives or learn the different cultures, right? So that we become more aware as individuals and address social justice issues in the world. So I'll let my team members read theirs and explain their findings.
Thanks, Brianna. So I think the biggest sort of takeaway that I had so far from the 4 interviews that I did is this consistent idea that art serves as a conversation starter about social justice topics. So one of the curators that I interviewed works primarily with dance. She was talking about how thinking through cultural appropriation in dance was this very difficult process for her and her organization, but it prompted really important dialogue for her staff and for the dancers as well. And so it served as this place not only to come together to dance, create art, but also to discuss important issues around social justice. Similarly, with another artist, he's an illustrator working primarily with visuals. He's talking about how art has a way of communicating ideas as that first step towards a larger conversation. So a quote from him is saying, those types of things, referring to more social justice depictions in artwork, bring art to the community where the community can say, oh, I see that. And then they actually say, oh, I see that. There's a difference between seeing artwork and seeing artwork. And I think that's where the visual artist's responsibility is. So there's a lot of conversation about not just the role that art can play, but perhaps a responsibility that artists have in bringing these sorts of conversations to the broader community. And I'll turn it over to Jessica.
Thanks, Taylor and Brianna. Just to add to what has already been started here, something that has been important to me as a researcher and scholar is Black feminist standpoint theory. Scholars like Patricia Hill Collins, who talk about how the very particular perspectives of Black women, their experiences in everyday life that change their relationships to their world, give them a kind of expertise that can't be ignored. And so in talking to my artists, I had multiple moments in conversation where this ability of art to share a different standpoint and to make clear the sort of expertise of another perspective and give people space to have those kinds of conversations around and across their different standpoints came up again and again.
So I'll also take the lead on this slide. So these were some reflections that we had discussed as a team, and then we're going to end this slide with thinking about our own reflections for our own research moving forward based on what we learned from the TGFP experience. So just to go through the slide, so there were difficulties navigating university red tape despite disciplinary approaches and multiple knowledges. Another one was multiple definitions of what social justice is or could be, both among us and with the community partner. Widely different approaches about or opinions about how art makes the community and how community makes art. And I think this was, again, in conversations with us, with the organization, but also in our conversations with the artist, especially when it came to intersecting social justice and art together and what that can mean. We did see some varying opinions from the people who we interviewed, and then more detailed conversations about desired outcomes with community partners can impact candidates for interviews. So we also feel like, you know, if we could have had more like in-depth conversations, which we had some good ones with the partner, or maybe just taking away from transdisciplinary research period, the more detailed you are about your conversations about what you're expecting on both sides of the table with the partner and with the researchers can impact like the candidates who you're giving for your interviews. So before I go into my reflections, Taylor or Jess, did you want to expand on any of these points? Because a couple of them, I did kind of forget what we were talking about with those. I'm not gonna lie.
I think the red tape was mostly about the IRB and communicating like what exactly we meant by our research and if it was really human subjects. But I don't know, and I think that you hit every other point. Jess, did you have anything you wanted to add?
Yes, I just wanted to bring up again the way words like social justice and advocacy in transdisciplinary research become words that mean so many different things, and sort of making space for the variety of standpoints and perspectives and figuring out how to like hold them even when they're kind of in conflict or in tension with each other was a big part of our learning throughout this project. And I would say that going forward, one sort of flag for me will be those words coming from my field and my discipline that I really think I know what they mean might mean something very different in these spaces, and like taking it slow, going into that conversation and really trying to hear what folks think and feel around the meaning of those words will be super important going forward.
Okay. So as we get into the personal reflections, I guess I'll lead and then you all can chime in, and I'll keep it short. So for me, I think that the participating in this program and in this project, one, opened up my eyes to like the possibilities of community engaged research. So before this project, I had not done an art-based study, especially with a community engaged like design or approach. I had done community engaged research before, but not as like one of the people who were helping to design it and were helping to have the conversations about what it would look like and what it would be for. So during this time that I was in the TGFP, I also defended my dissertation proposal, and also actually a few days ago received IRB approval to begin my own community engaged study. So things that I'm taking away from this is, one, slowness as a method, as Jessica taught me. I don't know, I think if she taught you too, Taylor, but most definitely taught me that from this. Also though, understanding like the mess of engaging in community engaged research, but also being appreciative of what that can bring. And two, letting the people who you are working with outside the university really be the experts of their own experiences, of their own needs, wants, and desires, and to like let that drive whatever it is that you all want to do, but also by setting, like being upfront about what it is that I also, would hope to get out of this project as well. It's most definitely informed my research epistemologies. It's most definitely informed like how important I think community engaged research is to where we're talking about education or public policy or urban planning or things that impact community. And to me, it also reshaped what research could look like when you move outside of, well, we're not at MSU now, but generally we are move outside of like the university.
Thank you for summarizing that so well. I'll try to follow. I really appreciated first and foremost just working with my team members. I think there was a really great group dynamic. And I think that the TGFP, like the program itself, did a lot of that groundwork to help us communicate and think through certain needs that we would have working in a team and those sorts of dynamics, but also they're just wonderful people. And so I've had a really positive group experience. One of the other kind of takeaways that I had was thinking not just about what it means to work in an interdisciplinary academic team, but then also realizing that the philosopher's perspective on this issue, yes, is different from the English or the education person's perspective, but is probably very different from the local potter's perspective. And so it's not just how can I effectively communicate my discipline, but also how can we as a team communicate sort of academic speak and have that sort of open dialogue in a way that doesn't get muddled or come across as pretentious or get confusing. And as Brianna said, recognizing expertise, especially when the words that I might be more familiar with aren't being used in that particular context. So that was one of the biggest takeaways or reflections I had. And then just as like a sort of smaller note, I've done a fair bit of sort of documentary video making work at this point. And so I was excited to do that again. And this is a consistent challenge, but especially in this project of representing the subject in a way that is fair and accurate, while also being mindful of the fact that, seldom does anyone have all the right answers. And often people are in various stages in their learning and growth, particularly on issues of social justice. And so how to correctly represent someone's perspectives while also not perpetuating any sort of potentially problematic or misunderstandings of the way that other people's experiences are, the way that movements are functioning. So that was a definitely challenging aspect for me of creating these stories of some artists around the topic of social justice in particular.
And so after all of those beautiful findings from Taylor and Brianna, I will come in and try to say something that builds off of that and is slightly different. So first, when we all met each other as a team with TGFP, I remember being a little prickly about my lack of belief in horizontal leadership, like the notion that there would be no hierarchy, because to me it seemed like a magical dream, but that could actually reinforce hierarchy if you didn't choose someone will be in charge and help us work through these things. I thought someone would just by default end up in that space, but instead I found with really open lines of communication, a lot of like text back and forths or long times in coffee shops and funny drawings on marker boards, that there was a way to create a sort of horizontal leadership dynamic in a team that could be sustaining for an entire project, which I thought was just kind of magical to move from my prickly self to where I wound up by the end. And then also I wanted to build off of what Brianna said about mess. So in my poetics research, I talk about mess as a potential method of creation, like sitting in the treble. There's this poet, Douglas Kearney, who talks about the way he works in mess and tension and pulls through it. And I just have always loved it, but thinking about it with one poet versus a collective of people from inside and outside of the university using terms in different ways with different needs, etc., is a little bit of a turn. And so imagining mess more broadly and trying to sort of stay with the potentials, like the generative moments of a time where you see something differently, because there's something to learn from that moment or that point of tension, I think is really important. And I'm glad that Brianna brought it up. And then the last thing that I wanted to talk about was just coming back to, again, trying to figure out how all these things from disability studies, like slow methods, are ones that we can communicate outside of those spaces, like our methods for accessibility as things move all online for the fall in many of these academic spaces we're in, and what that would look like in collaborative projects. And so I've gotten a chance to try to communicate that in this space and to try to imagine that with other people who are not necessarily in disability studies as a field. And I think that it's been a really generative opportunity.
Here's just our works cited. If you want these sent to you, we can do that. But I think at this time we can take questions. I think to see our faces better, I'm going to stop sharing the screens.
So if you have questions.
I want to jump in real quick, if I can, and just apologize to Brianna for not updating the slides to reflect that you're a PhD candidate. I apologize. I need to like cross out the student and put candidate in on the slide.
Thank you.
Congratulations.
Thank you. So with that, I'd like to invite anyone who has any questions for this team to put them in the chat, or if you're a fellow on the other team, you can also feel free to unmute yourself. I will also make it so that our participants from the Arts Council of Greater Lansing are now given permission to talk if they want to jump in as well. We have one question already from Matthew Stack in the chat, and it's if you could elaborate on the slow method.
Sure, I would be happy to. So it comes out of this piece towards a Crip of Color Critique by Gina B. Kim that we quoted in this, and in it she's just specifically talking about the ways in which Black feminist scholars in academia have chosen to move at a slow pace, or had to anyway. So Audre Lorde, going through cancer, asks her university for accommodations that will make it so she can have time and space to herself. They turn her down. And she has to go seek that out anyway. She ends up moving to Berlin, like making a community and trying to move at a pace outside of academia while still writing, while still producing work, but like letting it happen at the pace that she needs. And there's literally a moment where she is diagnosed with liver cancer and her doctors immediately want to operate, and she tells them like that she needs to actually do the research herself and figure things out and ask for a pause from these hasty doctors. And so that's where that slowness had been sort of imagined or worked on as a way of trying to be in academia when it's constantly asking you to move faster and faster. And then I've worked on it in creative groups where we've tried to imagine writing poetry at different paces, or even what it would mean to like read aloud or do a dance practice that incorporates slowness. And then for us, it just meant like a kind of gentleness. If an email takes a little while to get back to, if somebody's lost somebody due to COVID during this experience, if somebody's going through a miscarriage, like if somebody is having one of those experiences, we incorporated slowness and time for each other into our process. But we also maybe needed to communicate that up front and make a little bit more explicit the pace at which we were going. And we found that out as processes like IRB took longer, and the university didn't tell us they would take longer. We just had to wait for emails back. So we were on the other side of slowness not being communicated, and also had to figure out how to communicate it ourselves.
So I see a question in the chat from Robin. Thank you for your question, Robin. She's asking how we think our disciplinary backgrounds influenced our collaboration with each other, and what we learned about our own and each other's disciplinary perspectives. I think probably one of the easiest examples of how I sort of noticed that is when we were developing the interview questions. Was a really fun process and very clearly represented, I think, our different perspectives. And so as the philosopher, I was like, what is social justice? We got to ask that question of our participants, not because they don't necessarily have the answer, but that's just a pretty typical philosophy question. And I think it sets the stage for then what the following questions are going to be. But then Brianna and Jessica, both with their disciplinary perspectives, which I think they could elaborate better on, we're able to then say, well, we should probably also ask them about a time that they engaged with the community and what that felt like and what that looked like, or what kinds of perspectives that they have on this particular aspect of community engaged art work. And so I really appreciated learning from them, especially in that process, and seeing how I think they fit well together. I think we came up with a list of questions that flowed fairly naturally when I was going through the process. I think it all worked. So anyway, feel free to jump in, y'all.
I guess I'll go next. I think for me, so being in education, a lot of our projects are collaborative, but the process is a little bit different, right? It's so in education, one of my experiences on the projects I've been on, we're working collaboratively. We're often working to solve a present issue, right? Or address the present concern. So for example, right now, we're scrambling to get projects out that are examining reopening plans for schools, right? And we need it to be done quickly because we're responding to the context of what's going on. So for this, the slowness as a method thing, right? The amount of discussion that took place before we developed the protocols and things, that to me was a little bit new, right? We had to like Taylor described, we sat down and we was okay, we're gonna all just put it on paper and let's just organize and let's see how it comes out. I think also the use of terms and then the differences in how we document findings and process was also very different, and we learned some things from each other as far as different methodologies. And I remember I was throwing out all these words, these qualitative terms, and they were like, wait, what are you talking about? What is that? And I'm I apologize, I didn't realize that this is not something that is talked about in different disciplines, right? But it was the same way with me. I was I have never heard of this method before. I have no idea what this is. So to me, I think that's what made this project so unique, is that all of us had all these different understandings of what social justice is, how it applies, what's advocacy, what's community engaged work, what the methods look like, and we were able to put it all on paper and just craft it into something, which is what we did today.
Yeah, I was going to say specifically that Brianna taught me about what kind of reflection and taking stock can happen after an interview, and the way in which you can document that so you don't just lose it to the abyss. My field of English doesn't do a lot of community engaged research. My project is one, and I'm trying to make space for it in an English department where it's not typically done. So I found this to be an experience where I learned tools that I'm certain I will use in the future, and I'm grateful grateful that I had somebody in education who could teach me, like, here's how you keep it going when you have 7 projects happening at once and you have a community partner with whom you have a lot to learn, etc. Like Brianna was there with ideas and ways to communicate. And Taylor had a totally different line of asking questions. Right at this moment, we're in my own research project. I'm having to develop my questions that will guide me through my reading list and exam year. And so I found it to be a really generative time to be sitting in a community where there were other ways of asking questions and of documenting and doing community engaged research.
And also, I just want to add the tools, like the tools that Taylor introduced for us to like organize things online and to use for collaborative research. I was like, I have no idea why we're not using this over in Erickson Hall, but we need to bring it over there because they were really like, you know, really efficient too. So yeah, it worked out great. We have
So from the chat, I'm going to skip Michael's question. Sorry, Michael. And I'm going to go to Dawn from the Arts Council's question. Dawn wants to let you know that you've done an amazing job and that the video with Ryan was beautiful. And I agree. She is wondering about your experience with the interviews. Were there things that surprised you or moments that were unexpected in the process?
Yeah. I don't know if it, for me, if it was so much as like things that surprised me or were unexpected. I think I went into this really not knowing what to expect from the interviews. So I think the things that were most interesting to me was like kind of the diversity and like the different shapes that this art was taking, but how some of the artists like overlapped in their kind of like what guided the research for them. So for example, if we had, like if I interviewed 2 people who were very like advocacy based, social justice oriented, but when I took a look at their actual like work, their videos and their photos, they were drastically different. I would have never guessed that the same things was like guiding the work that they were doing, and that they thought about social justice in like very similar ways. So for me, I think that was the like interesting and exciting part, was realizing that. Oh, and also that I've walked past a lot of the art in Lansing and had no idea that, like, I even went back to some places in Lansing to take a look and see that, like, oh, this is here. And I look at this all the time and I never knew.
So for me, I found that each interview had a surprising answer to what is social justice. Like each time I went in and asked the question, I heard something very different. So in one of my interviews, I heard that social justice is something that like comes from on high and happens for people with suits and ties, and art was perceived as totally different and outside of that. Whereas for some people who were community engaged activists, like social justice was part of their everyday work, like not a word of academia. So it was interesting to hear the moments in which that word was seen as like scholarly and disassociated from the work the artist was doing versus the artist who saw everything that they were doing as grounded in that. And then another word that came up a lot in my interviews was placemaking, which is not something I had heard that much about, but the artists, based on work the Arts Council had done, had a real grip on placemaking and the way that their work changed the spaces that they inhabited. So Ryan talked about like putting a chalk drawing on a wall in a bar and how long that drawing stayed up untouched and what it meant when people would stop him on the street and tell him about that and how it changed his relationship to people he saw every day. And then he also talked about the challenges of placemaking during COVID and the way in which he's done a drawing every day for his students to continue learning from the spaces that they're in, but like not having some of those shared spaces of art making that they lost out on. So that was something that surprised me and that I wanted to hear more about as somebody who talks about like place in relation to climate in my work.
Yeah, thanks for your question, Dawn. I think for me, it was a lot of opportunities to see how one's artistic medium affects their responses. And so like I gave the example of one artist who's a visual artist and illustrator and was constantly talking about how to make social justice issues visible. And so his valuing on sight, on visual learning was very apparent. And I think that was fairly consistent across all the different types of interviews that I had. So I interviewed someone who works primarily with dance, another who's like fine arts and paints, visual arts, and then the fourth was kind of more of like a holistic gallery. And in each case, their answers were very clearly influenced by the work that they focus on. So I found that to be interesting. I think on a more challenging side of things, with COVID, I would have so preferred to have had a sort of informal just meeting with all of the artists beforehand. I think it would have helped set the tone better, communicate more about what we were up to, and made it feel more relaxed and be able to engage in their spaces. But I think given the circumstances, we were able to make it work. It was really fun. One artist had her interview in her studio and would walk around and kind of tour with her artwork and engage with it in that way. And that was an unexpected response in an interview, but a much welcome one. So I appreciated that.
And I just wanted to add too, I'm sorry. I also just want to acknowledge how fun it was to talk to the artists. It was really fun, and I feel like it was they were the connections that I feel like I know that I made in the interviews. The conversations went from very personal to professional and back, and I really did appreciate that.
So in our last 5 minutes of the symposium today, I want to ask if there's any questions from the attendees, any last questions, and then maybe invite Michael to give some closing words.
If there are no other questions, I guess the question that I asked the ACGL team, I'm kind of curious if maybe both teams would be willing to speak to that. It's for those of us who work in teams and also organize programs like this and maybe use teamwork in classes. The question of deliberation and decision making, and in general, kind of team leadership, is I think kind of a vexed one, because it can be tricky to figure out how to enable teams, especially short-lived teams, to identify in a comfortable way how that part of the process should go. And from where I'm sitting, especially based on these presentations, you folks figured it out. You made it work. And I'm very impressed by the quality of both presentations. And it would help me as someone who tries to continue learning about collaboration and this way of doing business, to find out a little bit more about what each of you did in identifying a leadership model that worked for you.
Jess, do you want to elaborate on horizontal leadership?
Sure. I guess we talked about at the beginning whether or not we wanted anybody to be the sort of person in charge, or whether we wanted to alternate who was the person in charge depending on the meeting. And instead it wound up being a task by task thing with I think we are, as people who have been the leaders on numerous projects in the past, very aware of who's doing what, how much time people are spending, etc. And so there was some things that we actually just were lucky enough to have the emotional intelligence to know. So there was a time where I was going through sort of a lot, and I had done a lot of the work on the IRB thing, and then suddenly Taylor and Brianna took the next 3 things in a row, and I felt a nice sort of calmness of not having to keep doing that. And I just felt like there was an awareness, and because it was something we talked about at the beginning, decided against having one person in charge, but then worked through each component of the project to put somebody in charge and then come back to each other on it and talk about how it went, that we sort of let leadership move around, and that it worked, I'd say, pretty consistently. But I don't know that model would work in every kind of team. I think it came from our past experiences and our knowledge as scholars that it could happen.
And to be like extra specific too, like it was even to the point where we would look at a calendar and say, okay, for the next 4 weeks, like I'm unavailable this week, I'm available this week. How can we delegate tasks so that one person's kind of taking the lead on various things in ways that actually work for our availability and capacity? Because even preparing this presentation, I was like, this is my first week of law school. I will look at the slides, but I will not be able to make them at all. So I can do stuff the week before, and that's kind of how we negotiated that more often than not.
Yeah, and we also had a conversation about at the beginning about our individual strengths, but also what our role usually is when we're on teams. So, like for example, and Jess, I don't want to throw you out there, but this is the first one that came to mind. She had mentioned on like day one that usually she does take the lead on a lot of things and, may carry the load if other people drop. So as we went through it, I think that was something that we were trying to be mindful of. Like, I know I would say, okay, these last 2 weeks, I could not do anything. And I know I see like just an email and she's doing all these things. So let me step in and see what I can take off her plate. We were very open in our communication, which worked really well for us. And I think that too, with all of our personalities, like we really had good luck with like putting them all in. Like they just went together really well.
Thank you. That's very helpful. We're kind of at time, but if the MMH team if they have anything to say in response to that, I'll speak a little bit curious about their perspective too.
I think I can answer pretty quick. We definitely incorporated like the calendar aspect. So I also defended my proposal for my PhD. So I was like, this month you can try to email me, but who knows if I'll get it. And that kind of corresponded with COVID. And so we had a little lull and it ended up working out. We did the same thing with our community partners because we had residents who do different rotations. And so they said things like, if I'm in the pediatrics rotation, I'm going to be working odd hours and I probably won't be able to come to meetings. And so we kind of factored that into when we planned meetings with our community partner. But we also, in terms of just like delegating work among our own team, we did it more like category based. And we kind of touched on this in our presentation. But for example, because I usually keep inbox 0 in my emails, I was usually keeping deadlines for presentations and things. Whereas Kathleen was better at responding to emails quickly from our community partner, and Andre, because he had done survey design before and had the more psychosocial aspects of the health belief model, he took the lead on survey design. So I think, again, the emotional intelligence and self-awareness to know when to support and when to lead really helped us.
Thanks, everybody. Stephanie, do you want to bring it home here?
Yeah, so I just want to thank all of you for your participation, your engagement, your desire to continue in light of COVID-19, and your flexibility and your resilience and strength for all of that. I've learned a lot from each of you over the past year, and it's been a real pleasure to work with you and see the projects evolve and to see your presentations as we've gone to different conferences virtually together and had this symposium. So I just want to give all of you a really big round of applause for all of the hard work you've done and all the wonderful products that you're creating. So thank you. And then, Michael, do you have a last word that you would like to put in?
No, I'm very pleased to have an opportunity to spend so much quality time with such amazing graduate students. It's like reinforces for me just how wonderful Michigan State is as a university. We're able to attract talented people like this to be a part of what we do. And, you know, the resilience and the flexibility and just the intelligence along multiple dimensions that are demonstrated by everyone involved is like humbling and remarkable and humbling at the same time. So I'm really grateful to all of the fellows for all of your hard work, and to the community partners who are still with us for you know, being willing to engage in what is, I think, a difficult and kind of intense, accelerated research, you know, opportunity. And so anyway, I feel like just really grateful to everyone for all the hard work you've done. Very impressive.
So with that, today we're going to wrap it up. Thank you all for coming to the Transdisciplinary Graduate Fellow Symposium, and for those of you who presented, for presenting your work and being willing to share that with the community. We will take this presentation and transcribe it and upload it to YouTube shortly. So thank you all for presenting, and we look forward to continuing our relationship with our community partners and to supporting our fellows as they endeavor into the future. Thank you all.